This segment of DelmarvaLife is sponsored by TidalHealth.
When it comes to the breath of life, you understand its rhythms and mysteries quite like a pulmonary doctor. From decoding chronic coughs to battling the silent grip of sleep apnea, these specialists spend their days navigating the complex landscape of lungs and airways.
They work to keep us breathing easy, often without us even realizing the sophisticated science behind every inhale and exhale. We're excited to introduce to you Dr. Wesam Sabbahi with TidalHealth Pulmonary and Critical Care. Welcome, Dr. Sabbahi, to Historic Studio D.
Hi, Lisa.
So, pulmonologist, tell us about some of the conditions you treat.
Well, we treat all sorts of pulmonary diseases, from the bread and butter, asthma, COPD, or chronic obstructive pulmonary disease, interstitial lung disease, where the lungs get fibrosed and that interferes with gas exchange and breathing process, sleep apnea, although that requires further training to be accredited to treat patients with sleep apnea, pulmonary hypertension, which is basically an elevated pressure in the pipe between the heart and the lungs, and sometimes lingering cough too. We treat that.
So you mentioned COPD, asthma, and sleep apnea.
Yep.
How common are these conditions, and when should we seek help with them?
Unfortunately, they're very common, and patients should seek help whenever they have bothering symptoms during the day or at night. For example, sleep apnea is mainly a nighttime disease. If you wake up gasping for air, if somebody tells you that you snore, if somebody tells you, hey, I'm looking at you sleeping, but you're probably not breathing, I'm worried about you. If you wake up feeling unrefreshed or waking up with morning headaches, those are the signs of obstructive sleep apnea that should make you see a doctor. For asthma and COPD, they're more like daytime breathing symptoms ranging from cough, acute or chronic, shortness of breath at rest, shortness of breath with activity, and wheezing. Those are the usual symptoms that come with asthma and COPD. They're under the obstructive lung disease umbrella, but they're kind of different, and they're all both treated with inhalers.
So, what role does healthy lungs play in our well-being?
A lot.
Yeah. Breathing is essential.
Yes. Well, if you think about it, the lung is the only internal organ that is in direct communication with the whole outside world. So the environment that you sit yourself in is the environment that you're sitting your lungs in. If you live in a clean environment, not surrounded by a lot of toxins, you're going to have clear, healthy lungs. But if you are surrounded by smokes, chronic and continuous toxins exposure, whether that is due to habits like cigarette smoking or due to work, that definitely affects your lungs and well-beings. And the long-term side effect of that is that most of these toxins exposures can lead to pretty bad outcomes like cancer, for example, lung cancer.
So how is technology changing the way you diagnose and treat these conditions?
Well, mainly in imaging. As imaging gets more sophisticated and more accurate, this helps me as a pulmonologist to categorize and classify certain diseases and measure the size of, let's say, a mass or a small nodule. That's when it comes to imaging. However, the coming part is bronchoscopy, which is the scope with a camera at the end of it that goes down the throat, and we take a look at the lung through that. Now we are having the robotic bronchoscopy, which they're very advanced. Basically, you bring a CD scan that has you bring a CD that has a CT scan loaded on it. We load that on the computer, and then we map your lungs. And after mapping the lungs, the scope on the robotic bronchoscope is much longer, and it can reach peripheral areas in the lungs to either take samples or do specific treatments. So that is, I would say, the growing. It's already there. It's not coming. It's already there, but it's where the direction of technology in pulmonary disease is heading. It's robotic bronchoscopy.
That's fascinating. Dr. Sabbahi, thank you so much for coming in, spending some time with us today.
My pleasure.
Thank you.
My pleasure.